Welcome everybody to the largest digital conference of the year. What an amazing turnout given the circumstance. Or maybe the circumstances have actually increased the interest in connecting with your peers and for us to collectively discuss the business implications of the current pandemic. Now, I will not attempt to talk about the COVID-19 pandemic itself. We should leave that to the medical experts and scientists. And while the risk for health, lives, and livelihoods are real, and I'm actually speaking from downtown Manhattan right now, it's very real here, like in many other parts of the world, we want to try to step away from those immediate concerns just for a moment and focus on the short, mid, and longer term implications for our industry. Now, we can already see how this pandemic event is accelerating certain industry trends and raises new problems that need to be solved. So we will talk about some practical things the industry can do right now to make it through the next 6, maybe even 12 months. And post the containment of the virus, however, we do not expect the world, and by implications our industry, will return to a pre-pandemic scenario. While nobody can claim that they actually know exactly what the future looks like, we can explore the dynamics that are currently playing out and look how those dynamics will shape the future and what different scenarios in the future could look like. So to do this, I would like to invite my colleagues to the virtual stage. And Michelle Keefe, President of Commercial Solutions at Syneos, and Elena Bonfiglioli, who leads the health and life science industry business in EMEA for Microsoft, will walk us through how the life science industry is currently adapting. Michelle.
Hey everybody, I'm Michelle Keefe and I'm the president of Syneos Health's commercial division. First of all, I wanted to take this opportunity to make sure that you and your families and your colleagues are safe and healthy. I know we are in unprecedented times as a society. And so I really thought it was important that I kind of scrap my original talk for this eyeforpharma conference and decided to focus probably on the only thing we can really do at this moment. And that is, how do we focus on patients who are counting on us as a healthcare industry? And really, it's probably the time for us to be really embracing a new commercial model that was designed for this new era that we are in. This is a crisis that is accelerating change that we knew we already needed to make, right? This is not new information. This is change we knew was coming, but now we have to do it at a much faster pace. For years, every life sciences company has explored new ways to be more customer-centric, to explore multi-channel or omni-channel solutions, to try to be more digital, to be more data-driven, to figure out how do we truly complement personal promotion with non-personal. And it's clear that the crisis is accelerating the need for that change today. We're seeing dramatic declines in face-to-face detailing and in-person events, and all the data supports it. And I think we all know that this is going to be our new normal, at least some of the time moving forward. So we have no choice but to respond to this situation. And it really is what our customers need us to do at this time. The way I think about it, or we think about it, it's not about the omni-channel future, it's about omni-channel right now. The HCP or patient is at the absolute center of our thinking. Every channel, personal and non-personal, is synchronized. And what you see is that one channel is reflected in the other. And this new world relies heavily on data and analytics. As you know, we're strategic partners with Omnipresence and Microsoft. The next generation technology of Omnipresence makes all of this possible. It's built with customer experience and analytics front and center that are truly game-changing. But to do this right, we need more than technology. Beyond technology, we really need a new model for right now. I'm not going to go through this slide in detail, but at Syneos Health, we regularly help clients design and execute these kinds of modern commercial programs. Whether it's applying data science to expand your targeting, or syncing up across a contact center and engagement center, digital and remote, or trying to tie it all together with integrated analytics. We know the game plan. And we do it with full inclusion of one of the most powerful resources you have. We do this regularly with your field professionals. They know your product, they know your customers, and they can be incredibly effective in a remote approach. My message to you is you can do this, and you can do it quickly and efficiently. To make it even simpler, here are 4 right now tactics you should be deploying at scale. First, advanced targeting. Sophisticated data science for discovery of new high-value audience clusters. Second, remote detailing. New tools and techniques to quickly convert face-to-face teams to effective remote advisors. Third, engagement center. Flexible overlay support to fuel video, chat, and voice connection on demand or based on an invitation. And one-to-one digital engagement, person-level relevance, and person-level relevant content delivered in digital media to maximize brand reach and frequency. As important as it is to get each tactic right, we also need to tie everything together to make sure the customer sees this as one truly connected experience. So we do this in 2 ways. We do it clearly through technology. It's important, and omnipresence is built from the ground up to help. But at Syneos, we have a lot of experience with advanced commercial models, and we believe it's all about the true integration, getting the structure, the people, and the process right can be tricky. We have an entire team that we call commercial integration that solves this precise problem with and for our clients. It is a skill. It's a skill to not just think in an integrated way, but to deliver flawlessly an integrated model. And again, my message to you is you can do this, and you can do this today. We all know that the times are crazy, but think about how different life was like just maybe 4 weeks ago when we were all still planning to travel to Barcelona for eyeforpharma. To say we're in challenging times is an understatement, but our customers are counting on us, and our patients are counting on us. And I do know this. People will remember what we do right now. If there's anything I can do personally to help you or your teams navigate this time, please do not hesitate to reach out. Thank you.
Good morning. It is a pleasure to be here with all of you. Thanks to my fellow panelists, and thank you to eyeforpharma for bringing us together at times of great disruption. There has never been a more appropriate time to look at the role of healthcare and technology combined together. There has never been an appropriate time to really look at how technology can shape new digital experiences that can alleviate the burden on already overwhelmed healthcare organization. New digital experiences that can help liberate time, liberate resources, creatively shape workflows in new ways, and really help do what is the most pressing of all needs, which is provide the most urgent and best care for patients. In the light of the global crisis, I thought it would be of interest to share with you ways in which Microsoft has been helping customers alleviate the pressure on health systems and also working with many organizations on the front line with a first responder mindset. Many of you will agree with the statement that is now on the slide. And we all know that healthcare is probably the sector in which the application of technology overall, of cloud and AI in particular, is much needed. However, it is exactly in times of disruption that we get to see the degree of urgency and the need more deeply. And one of the lessons that we are learning is that what is critical is the scale of adoption. We refer to this concept as tech intensity, which is the equation of great technology development that we do from the Microsoft side, but also development that we enable in each and every one of our customers, as every organization is becoming an AI organization. So I was saying tech intensity as the equation of great tech development multiplied by the degree of tech adoption, elevated to the power of trust. So because of the need of that deployment of technology and adoption of technology at scale, we have launched a program to help customers respond to the COVID-19 crisis. And that customer support program has been focusing on accelerating the adoption of healthcare solutions that enable personalized care, to triage patient, to empower healthcare collaborations, and provide immediate access to virtual care. In the response to the COVID-19 emergency, we are seeing the benefits coming from the scale adoption of technology that is already existing. So let's take a look at 4 key tech enablers. First of all, smart agents that are allowing to flatten the curve of incoming calls and help effective and safe triage of these calls from citizens and patients, allowing health organizations to screen patients at scale. Many organizations like the Center for Disease Control, the CDC, just released COVID-19 assessment bot. This assessment bot has been built on the Microsoft Healthcare Bot service that is an AI-enabled support agent that can quickly help assess the symptoms and the risk factors of people that are concerned about their level of infection. Using artificial intelligence, the bot suggests the next course of action. Is it, for example, contacting a provider, or for those that do not need in-person medical care, managing their condition safely in their homes? Bot-like solutions are already integrated in solutions like Omnipresence by Indegene, and are allowing healthcare professionals to interact in new ways with pharma associates and pharma professionals, allowing a redesign of digital experiences. We have seen a rapid deployment of these types of bot solutions, 24, 36, 48 hours. Already, it was mid-March when the Helsinki University Hospital in Finland released the Corona Bot, which included questions about symptoms, interactions with those that already had the infection, understanding of basic illnesses and potential exposure risk. And based on the answers, the bot could estimate also the likelihood of a COVID infection and give specific instructions, of course, aligned to a medical protocol. Secondly, Let's look at the use of Power BI and data-driven decision-making, data platform, machine learning to reason over data to help aggregate data sets into easy visualization in order to provide guidance and help direct optimal use of resources to prioritize healthcare interventions. Last week, we released a new Power Platform template to help customers share information and collaborate during a crisis, which has now been installed by over 2,000 customers, healthcare customers around the world. The Danish capital region, who actually deployed initially the bot, then could aggregate data coming from questions of citizens that were asking the healthcare bot to understand and visualize hotspots, to understand what was going on and help Danish authorities really take the next best action. In the UK, actually, Microsoft has been working with NHSX, NHS England, and NHS Improvement with their technical teams who have already built together a back-end data cloud platform, helping multiple data sources coming together into a single secure location. Thirdly, and how do we leverage technology to empower collaboration and communication at scale? This is technology that is already out there, right? Cloud-based collaboration and communication solutions like Teams can be used and are being used for teleconsultations and telemedicine to enable a doctor visit at distance, but also to enable the encounter of a healthcare professional with a pharma professional. In the UK, the NHS Calderail has been implementing virtual visits within the matter of less than a week for patients and clinicians to have secure conversations and discuss the next best interaction for their care. More broadly, in the NHS, we are empowering over 1 million health professionals to collaborate securely using Teams. Last but not least, when it comes to leveraging mixed reality to support maintenance of supply chain and new workflow that can be done and assisted remotely. Remote assistance of workers that are in need of manufacturing support on the front line are possible. They are a reality. Microsoft and partners have announced new program to increase the predictability and the reliability of work that needs to be performed by manufacturers. Is it by taking application for their robotic process automation resources to help maintain critical business continuity, or to enable industrial workers to use both hands as they are going through complex procedures, of course, with the assistance of virtual technology, or doing at-scale training using hands-on type of training support with enhanced with virtual reality. So when we bring it all together, first of all, it's not even about new technology, new point solution, but it is about the vast application at scale and at pace of existing technology. So when it comes to disruption times, it is really the adoption at systemic level of existing technology that can help shape the resilience, the responsiveness of health organization, and that can help shape new digital experiences. I would like to conclude by saying we are writing history. We are writing present and future history. We are doing it together. We are learning a lot in terms of tech adoption, and it is clearly the case that when we look at solutions like the one that Indegene or Microsoft and others are bringing together, technology can help liberate productivity, strengthen the level of resilience of healthcare systems around the world, and most of all, keep us safe with the best care possible. Stay safe, and thanks for watching.
Oh, thank you, Michelle and Jelena. That was really interesting and insightful. And now I would like for us to pivot toward looking more at the longer term implications of this pandemic crisis, the trends that appear to accelerate, new challenges that are being introduced, and the strategic implications and directions that we need to prepare for what might come after this is contained. Now, even before the crisis hit here in the US, access to HCPs had already hit a low point, with almost 60% being inaccessible. For sales reps, now with most of the big pharma companies having pulled their reps from the field already, and even proactively, and customers' concerns about general exposure and also limited services they're providing right now, you can easily imagine that a face-to-face interaction between a doctor and a sales rep is a real rarity, probably around the globe. Along with that, 24 medical events have been canceled or delayed just in this short window of time. And I cannot imagine that large-scale medical face-to-face conferences will be the most interesting event in the near future for doctors to attend. Now, within the life science companies, managers are clearly not comfortable with an extended remote working model. They are concerned that it ultimately will not deliver the same quality and even quantity of work from their teams. In this scenario, it's important to create digital continuity. Continuity to commercial teams between themselves, but also commercial teams to the customers. Other customer-facing teams like key account managers and MSLs, they need to be enabled right now. Most companies are in the process to ensure that they can effective personal remote engagement and also remote services. And there should be some real payoff with that right now, because pharmaceuticals still measures relatively low on the digital maturity scale, even if you compare it to other regulated industries like finance and insurance. And so there's some benefit to be had here. Though, as we look past the immediate crisis and we see what strategies we can adopt, we see one constant in this sea storm of change, and that's customer experience. We at Indegene believe strongly that it will be at the center of any successful strategy post this current crisis, regardless of how the future scenarios play out. We believe that focusing on customer experience delivers value both for customers and your business. Now, that's not a new trend necessarily. In fact, the companies have been competing on the customer experience dimension over the last decade have doubled. And you can think about companies like Amazon and Apple, and it has not only contributed to higher customer satisfaction, but actually for those businesses manifested itself in real revenue increases and financial and commercial success. The Chief Customer Experience Officer of MasterCard believes that a blended experience between digital and physical worlds will create the best customer experience and dominate the next era of marketing. And when you think about it, you know, businesses that look at people, analyze the interactions they're having on any channel, also understanding their locations and the devices that they're using. Those companies outside of life science and healthcare are already delivering some of these blended experiences. Uber is a great example, but each one of you for sure has a bunch of apps on their phone, interacting with companies that deliver such a blended experience, and you benefit from those from that customer experience, and you're happy doing business with them. So these companies are already ahead of the curve. Now, as it comes to the life science industry, we believe that this crisis is driving not just to a perpetuation of or acceleration of the current digital trends that we've been living through, but it will come to what we call a digital reset, a redefinition of what it means to engage with customers, face-to-face and digitally, and all at the same time, having any of these engagements be highly, highly personal and personalized. Now, this digital reset will define itself in the context of some dramatic changes in our society, and how, as a result, the global consumer expects to engage with businesses in general. On the other side, we've seen how this crisis has accelerated some trials and had led regulators accelerate some trials, and other trials have been delayed. But we believe that regulations post this crisis will go beyond the clinical trial area of a business. There's a high likelihood that regulations will be imposed on customers and businesses alike to ensure there's ongoing safety. So you can imagine scenarios on who can enter a hospital, Who can even enter a doctor's office? We know that in the US today, doctors are already putting practices in place with pre-screeners for patients to attend. They're leveraging technology to create virtual waiting rooms so people wait in their cars and are not tightly packed in an actual office waiting room, and they check in remotely on their mobile devices. Those things are happening right now. And some of it will come from the business, and some of it will come from regulators to protect people, to protect patients, and to protect personnel. Ultimately, there's also shifting changes in the industry challenges. Not the challenges will go away, but some might become a lot more urgent and pertinent, and others might become a little bit lesser in priority. Now, if you can define for your business, for your company, what it will take to deliver a great customer experience in the context of this framework, you will be able to drive successful strategies and capabilities. And the capabilities you will need when we actually come out on the other side of this crisis. Now, for us here at Indegene, Syneos, and Microsoft, this means we are working together on a new platform that helps customers succeed as the digital reset ushers in a new era of our industry. Now, in closing, I'd like to thank both Michelle and Elena, and actually all of you for joining us today in kicking off this exciting digital conference. We hope you have learned a few new ways to think about digital continuity during this challenging time, and hopefully you'll hear a lot more in the following sessions. And please feel free to ask us questions right now. We're available right now for Q&A, and I look forward to continuing this dialogue and finding solutions with many of you in the months and weeks to come. Thank you. Please start your questions.